Dr. Vikki Petersen here. I have some very good news that I'm excited to share with you, and it's in the topic of diagnosis of gluten sensitivity and celiac disease. As you've heard me talk about in the past, really one of our greatest liabilities in either problem, whether it's celiac or gluten, is that we do not have tests that are very accurate. They're not highly sensitive, meaning that we get a lot of false negatives. A lot of patients with celiac disease are told they're fine. A lot of patients with gluten sensitivity are similarly told that they're fine, but they get stuck in this kind of conundrum of the test says I'm fine, but I know darn well that when I don't eat gluten, I feel demonstrably better. And when I do get into gluten, I feel demonstrably worse. But it's kind of tough because so much gluten is in our environment that sometimes when push comes to shove and that gluten is there and you're very hungry, it's easy to say, well, I don't really have that problem because that test was negative. We know better, of course, but we do justify these things when they occur. So what I've been waiting for about 2 years is a laboratory to start working that I've known about because I knew they were working to develop these tests, and it seemed like an awfully long wait, but I'm happy to say that they are now officially open. And what this laboratory does, it's called Cyrex, C-Y-R-E-X. Now, the good news is that it exists now, and they have some wonderful tests, which I'll talk to you about. The bad news is that you do have to go through a doctor, meaning, not that that's bad news, but it's not something that you can do online or order the tests yourself or anything like that. So you do need to work with a doctor who's aware of this, and certainly it's nothing wrong with making your doctor aware of these tests. So let's look at a couple of things that they're offering, and I think you'll see why I'm so excited about it. So one is that, as you know, gluten is a protein. Gliadin is the protein that we know causes a problem, and a lot of the laboratory tests that we've had up to this point are looking at a certain piece of gliadin called alpha gliadin. So that's the Greek alphabet, so A, alpha, the first letter. But suffice to say, this alpha gliadin has been one that has been seen to be positive in about 50% of celiacs. Now, that's certainly better than 5%, but 50% means you're missing as many as you're catching. Yet, that's been the only test available to us. And what we're aware of is this one chunk of protein that's called a peptide, this one piece of it, the alpha gliadin, is the test we have been using, but that's one, and there are over 60 of these peptides or chunks of protein in gliadin, and we've only looked for the one. Now what this lab is offering is 10 others, so we have 10 times the opportunity to find out that people are reacting to gluten. These are people we would have missed before. So this is very exciting. Some of these peptides that they'll be looking at are considered more diagnostically sensitive than even the alpha gliadin that we have been using. So that is great news. The other thing that this laboratory is offering is a test that measures how leaky or permeable your gut is. If you listen to me at all, you know that I talk about that a lot. That's the damage caused by gluten, often caused by certain drugs and infections, as you get this leaky or hyperpermeable gut, and that is something that has to be fixed in order to regain optimal health. So now we have a test that will help judge how we're moving along in achieving that goal, which is great. This is another first. We haven't had this kind of test in the past. I'm just going to talk about 3 of them. They have several tests, but the third one that I'm excited about is something called a cross-reactivity. So what that means is that if you're gluten sensitive, sometimes you'll eat other foods that have a similar makeup. Remember, we're talking about proteins here, and so we see this a lot with dairy products, that people can cross-react between gluten and dairy products and not do well with dairy. I'll just put a little caveat in there, a little parentheses, and let you know I don't think anyone should consume dairy products, but we'll save that for another video. However, this particular lab is going to be testing 24 different foods that people can cross-react to. So all this means is that when you eat a certain food, let's say it's rice or corn, your body, because of the leaky gut and because the fact that your immune system is so overworked, it's not sensitive to the distinction between the two. It's almost like if I held up two different fingers, let's say. So we have the index finger, we have the middle finger, they're different, right? But if I, held them up a certain way, you'd say, oh, those are exactly the same. You see, you could get a little confused because they have similarities. Body much the same. So it sees a food that's not gluten, but it reacts as if it were. So you could be perfectly perfect on your gluten-free diet, but you're eating this other food and your body's having a negative reaction. We can now learn what those foods are. Now that does not mean you can never eat those foods again. What it does mean is we have to settle down your immune system. We have to do a better job at healing your gut, and then you'll get better digestion of your food. Your immune system will be less hypervigilant and excited, and it will understand the distinction between those two and stop reacting to that food that's not gluten. So these are some of the tests that are going to be offered, and I'm very excited about them. As I said, it does require working with a doctor, so I know for some of you who contact me and have trouble getting their doctor to do any kind of testing, this is not necessarily, maybe you won't be as excited as I am, but here's what we are doing. The fact that these tests exist, more doctors will learn about them. If I have anything to say about it, I know the people who own this lab feel very strongly about educating clinicians, and they already have thousands of doctors apparently who are awaiting this information. So we're going to raise awareness. That's really what it's all about, and then this will be more mainstream and easier to get a hold of. In the meantime, we go back to what I've always told you, which is there's absolutely nothing wrong with you doing a gluten-free challenge. You eliminate gluten for 30 days, see how you feel, and realize that's a great test right there. If you feel better going gluten-free, there you go, it's positive, and now you know. So, but these tests just really broaden things out for us, and so for those of us who can use them, this is good news. And I think it's good news for everyone, as I said, because it really is showing that there is more understanding and gives us greater tools, and we'll be diagnosing more people. So all in all, good news, and I hope this finds you well and happy. And until next time, I wish you very good health.